Well, let's just look at some more MRIs. Today we're going to look at MRIs of the cervical spine. We've talked about disc disease and things like that. Today we're going to look at MRIs of the cervical spine, just look at a bunch of them. Because many times you'll get an MRI of your neck and you're told, I got all this stuff. You read this radiology report and it's like 400 pages long, degenerative this, degenerative that, spurs, facets, ruptured disc, spinal stenosis. So what does all this mean? I think the best way to really sort of know is just look at a bunch of films. So let's do that today. It's going to be sort of fun. So this first one is just a normal MRI of the cervical spine. And you see the spinal cord there in the middle, and all the white fluid around it shows there's plenty of cushion. And so that's just a normal MRI of the cervical spine. That's a T2 weighted image. And then the next one is a T1 weighted image, is normal MRI of the cervical spine where the fluid is black. The next one is another normal, and this is just like a perfectly normal MRI of the cervical spine. You see the spinal cord with white fluid all around it. It just looks perfect. And this next one, you'll see a disc herniation. It's C3, 4, but C6, 7, just right there in the middle. There's a disc herniation distorting the spinal cord just a little bit. So that's very different from the normal we just saw. And then on the right, you'll see this small disc herniation at C6, 7 on the right on the sagittal view. This is where we cut it, you know, like a cross section, like you're cutting a sausage. And the next one, you see this huge disc herniation at C5, 6, distorting the spinal cord. You'll see some little bulges at other levels, but this C5, 6 is the worst. And then you'll see the sagittal view where it's smashing the spinal cord flat there at C5, 6, that big disc herniation, smashing the spinal cord flat. And this next one, this looks awful. What do you do with a neck like this? Just terrible cervical spondylitic myeloradiculopathy. You can't fix a neck like this with surgery. And this is where we make a lot of mistakes. We try to operate on people that have terrible arthritis. It's a very elderly 80-year-old man, but the problem is his spinal cord's at risk. So they're going to have to decompress C3-4, but he's not going to be well ever with regard to his neck. And then this is another view which shows the stir sequences, which shows the spinal cord bruises. Compare that to the first film that we saw and how good that one looked. And then look at this one. And then the spinal stenosis is just extreme. The spinal cord is smashed flat where you see no fluid around it. Here's another one from C4-5, C5-6, C6-7, 3-level disease, big spurs with a contusion of the spinal cord adjacent to C5-6. And then here's another one. It's already been fused at C4-5, and then it's got severe spinal stenosis. It's been fused at C3-4 as severe spinal stenosis C4-5, and about 30 to 40% of the time you rupture the disc below the level of fusion. Here's another one, C3-4, large disc herniation, and see the white that's in the spinal cord. That's a bruise. This is a spinal cord at risk. You just have to have surgery here. You're very close to being paralyzed from your neck down. If you have a little fall in the shower, get a rear end fender bender, you can be paralyzed with the neck down. And there's a little disc on the left and pressing on the spinal cord. And this next one is similar thing, C5-6, but a big soft disc herniation. You see how white that disc is? That's a soft disc herniation. That means it's fairly acute, and it is distorting the sac, the equal sac where the spinal cord is. See all the whiteness around the spinal cord above and below, and there's none here at C5-6 and C6-7. That's spinal stenosis. This needs to be fixed. Here's another one that's just got terrible, disease, the spinal cord contusion. See that blue area? It's pointing at the spinal cord. And here's another one, a large spondylitic bar at C4-5 and C5-6 with severe spinal cord compression. And this needs 2-level fusion to decompress that disc. Here's another one that's, got severe cervical spondylitic myeloradiculopathy. But once again, you see how bad the upper 5 levels are. You just can't fix this neck. You're going to have to fix C5-6, but you can't fix the whole thing. You're still going to have problems. And this is the kind that are really painful where the blue areas, that's a disc herniation laterally. This should look like Mickey Mouse. See his face and his ears, and that left ear is sort of amputated. And then here's another one with significant cervical spondylitic changes, significant degenerative disc disease. But at C5-6, you got severe spinal cord compression. Here's another one that you got a spinal cord contusion, adjacent C3-4, but multi-level disease, probably 6 levels. You have degenerative disc disease with anterior osteophytes and spurring. Here's another one with a very big disc herniation at C6-7 and spinal stenosis. And here's one that's had a fusion C4 through C6. It's the way it normally looks post-op, just a big mess. That's why we can't really use MRI to assess the fusion, because, you know, it's just titanium and it just causes artifact. But this would be a pretty normal post-op MRI. And then the next one is another disc herniation at C6-7. It's a wider colored disc. See the blue arrow pointing at it. Acute disc herniation with spinal stenosis. And then another one with two more with spinal contusions. This last one after a fusion. Severe myelomalacia, spinal cord atrophy and contusion. And here's another one that's sort of a fairly new disc herniation. It's C6-7, a large broad-based bulge of the disc is C6-7. And then another one is C4-5 with another spinal cord contusion. It's so important for someone like me to look at these films because this is a spinal cord at risk of being paralyzed with an injury or fall. And here's a very small central disc bulge that doesn't really require surgery. Another terrible looking neck, cervical spondylitic myeloradiculopathy with multiple contusions of the spinal cord, C3-4, C4-5, C5-6. And another one with a large spondylitic bulge, C3-4. The top 4 levels look terrible with a bruise. The spinal cord at C3-4 is going to need extensive decompression. And here's another one with the spondylitic bar across C3-4 spinal stenosis, a little, hemangioma of the C4 vertebral body. And here's another small broad-based bulge of the disc noted. And here's another huge spur spondylitic bar at C3-4. This person was spastic in their legs, severe spinal cord compression and a contusion. Here's another one with the same patient at C3-4 that shows the stir sequences of the contusion. And then the sagittal view, you see that spur right in the center smashing the spinal cord flat. Here's another one, a big disc spur C4-5, C5-6 with distortion of spinal cord at risk. And here's another post-op MRI. Patients had a fusion C5 and C7, pretty normal post-op MRI. And another with C3-4 with a large spinal cord contusion. Person's going to need surgery to have a spinal cord at risk. And then here's another one with multi-level disease, C3-4, C4-5, C5-6, C6-7, C17-1 with a contusion adjacent to C5-6. Another one with a large spur at C3-4, it's bruised the spinal cord, it's going to need surgery. And you see the axial view, how it's smashing the spinal cord flat. Here's another one, a large spur at C3-4, spinal cord contusion. The central version, the axial view, is with spinal stenosis. So that's amazing when you look at it, and let's look at a few of the normal ones again. It's just amazing what people have in their neck and don't know it. So if you get all this junk read on this film by the radiologist, go see a neurologist, neurosurgeon, let him actually look at the films. That'd be a first question I'd say, did you look at my films? A lot of times you're seeing the primary care providers and they really don't know exactly what to look at. So if they're not looking at your films and you have all that, get referred to a neurologist or neurosurgeon will look at their films. Fascinating MRIs of patients that have significant disc disease in their neck. Now, this is Dr. Caldwell Miller, the brain doctor. Like, comment, subscribe. I do answer every question in a few days, so ask me questions if you have them. More later.